The Walter Cronkite School of Journalism and Mass Communication at Arizona State University is a proud supporter of Indian Country Today. Students at Cronkite News and Gaylord College at the University of Oklahoma cover Indigenous communities together. This important work is distributed by more than 100 news organizations. This collaboration provides a much-needed boost to coverage of Native American communities nationwide. Learn more at cronkitenews.azpbs.org.
This is Indian Country Today.
Esquili, yes, thank you for joining us. I'm Patty Talahongva. Here are the headlines from Indian Country Today. The Bush Foundation is addressing the wealth gap with $100 million in grants. The idea is simple. They want to invest in 2 community trust funds to support wealth building for Black and Native communities. The Bush Foundation is based in Minnesota, and that's where they're starting the investments. Other states include North Dakota and South Dakota and the 23 Native nations that live in those areas. The foundation will select organizations to receive the funds and design and operate grant programs to distribute the $100 million. The grant programs are intended to serve individuals who have a need for a financial boost to access wealth-building opportunities, such as getting an education, buying a home, or starting a business.
Well, certainly the wealth and this money that we're investing today, this $100 million, is not even a drop in the bucket in the amount of impact that it is needed to be, to be made up for those injustices. But we do feel it's important to act now, to take some actions now with this wealth to see that this scale of change can be really meaningful for Black and Native American communities.
In addition to the $100 million in new funding, the foundation will also direct $50 million through its regular grant-making programs over the next 5 years, all to support community-driven approaches that address racial wealth gaps within and across cultural communities. The Manitoba Métis Federation is creating a $1 million fund to support families with missing or murdered loved ones. The PK Tahin program is a Michif phrase that translates to Bring Me Home. The program will offer $10,000 rewards to people who have information that leads to finding the missing people. The funding will also be used for billboards placed near the last known location of the missing person to remind everyone that they never made their way home. The first $10,000 reward is being offered for information on Marcus McKay. He was just 8 years old when he was last seen on July 15, 2000. Godzilla vs. Kong is a blockbuster of a film with a $200 million budget, and it's in theaters and on HBO Max now. Among the lead actors is Julian Dennison, the Indigenous Maori actor known for such films as Hunt for the Wilder People and Deadpool 2. Indian Country Today's associate editor, Vincent Schilling, sat down with Dennison and spoke to him about his work in the movie.
Hey, Julian. Vincent Schilling here. How are you?
Good, thank you.
Good. First of all, let me tell you, you are hilarious.
Thank you.
Dude, I love what you do. I am an Indigenous journalist. I'm Mohawk. And, you're Indigenous from New Zealand. And we were talking just before came into interview, and they said, he's been talking a lot about reaching out to the Indigenous communities within New Zealand and where you're at, of things you're doing. I'd love to know how you're doing that.
It's very special that Indigenous people have a voice. Māori, that's who we are in New Zealand. Mm-hmm. And I think it's important that, like what Taika Waititi said when he won the Oscar last year, Indigenous people have a voice, and it's time to stand up. And I think it's very important that we acknowledge that we do have stories. We are storytellers, and we are the original storytellers. And I think it's, like I said, it's important that we stand up for ourselves and that we do have a voice. And it's so important to speak out, especially the world is in an uncertain place. And I think it's good to find some clarity in that. And I think that clarity comes from us.
Yeah. And bringing this Indigenous voice to, Godzilla versus Kong. So what's next? We're going to have a New Zealand Kiwi the size of Kong.
That'd it's a giant kangaroo from Australia.
Yeah, that's what I want to see.
Be yourself. That's what I've always said. Be yourself. Don't try to be anyone you aren't. And we are the original storytellers. We do have a special place in this industry, and I feel like you're saying, we're going in a route where the industry wants to identify and really put in the spotlight Indigenous stories, Indigenous actors, and people just know that there's a heart and there's a soul behind us. And be yourself, be who you are, and know where you come from. Stand firm in your beliefs and your people. You'll make it.
Yeah.
You can read the Native Nerd review on Godzilla vs. Kong and see the entire interview at IndianCountryToday.com. And those are the headlines from Indian Country Today. I'm Patty Talahongva. When we come back, do you have questions about the coronavirus vaccine?
Patty, we're going to speak today with a doctor who will give us the latest information on vaccines, and we'll be right back. Dr. Mary Owen is a member of the Tlingit tribe. She graduated from the University of Minnesota Medical School and North Memorial Family Practice Residency Program before returning home to work for her tribal community in Juneau, Alaska. After 11 years of full-scope family medicine, she returned to the University of Minnesota Medical School, Duluth, in 2014 as the director of the Center for American Indian and Minority Health. Her work includes developing and managing programs to increase the numbers of American Indians and Alaska Native students entering medical careers, outreaching to local and national Native leaders to ensure the University of Minnesota Medical School remains in tune with Alaska Native and American Indian healthcare and education needs. She continues to provide clinical care at the Center for American Indian Resources in Duluth and is the current president of the American Association of American Indian Physicians. Welcome, Dr. Owen.
Miigwech. Thank you.
How do you think vaccines are working in Indian country overall?
I think overall, Indian country is doing a fantastic job of getting these vaccines out. We have a public health infrastructure that's helping get that done better than probably anywhere else in the country.
And kind of what are there regional differences in how it's being distributed?
I don't know about the regional differences of distribution. Probably from, tribes could either get the vaccines from the federal government or from the tribes. So I understand there are some differences depending on the state that you're in on how it was distributed, but I can't give you specifics on that. And then dissemination from I think all of our tribal communities have done great, again, because that public health structure and having public health nurses who can reach out to our community members. And we're showing other people how to do this well.
What are some of the basics that people should know about, such as if you've had COVID, should you still get a vaccine?
You should still get the vaccine if you've had COVID. And there are lots of, people are worried about if they have immune problems or if they're immunocompromised. That's even more reason to get the vaccine. You just need to talk to your doctor about it. Pregnant people can get the vaccine. There are very few people who can't get the vaccine. If you've had an allergic reaction before, you can still get the vaccine. We just need to know about it and prep for it. What are the other groups sometimes? Those are the main ones that I hear about. Almost everybody can get it. Of course, children can't. Anybody under 16 for, I believe, the Pfizer and Moderna, and it might be 18 for the J&J.
There's a lot of discussion about which vaccine, and I keep hearing that the best vaccine is the one you can access. And I'm curious your take on that.
As a health care provider, I'm going to say the same thing. We need everybody vaccinated. And if that's what your clinic has, they all show good efficacy and they've all been tested more than any other vaccines that we've ever had. So get the vaccine that's available to you.
And there's an interesting history there because American Indians and Alaska Natives still need to get more flu vaccines and other routine vaccine care. I think the latest I saw is we're still way below other populations, yet way ahead on this one.
Isn't that interesting? I'm going to get this name wrong, but the Urban Indian Health Institute out of Seattle did that nice study that of 1,000 Native people over the country. and saw that 75% of our Native community was planning on getting it, and 75% of them, or 3/4 of them, were going to get it because they knew that it helped our community. So I think if we can convey that same message about the flu vaccine, because it protects people in our community the same way that this vaccine does for COVID, then we're going to be on spot and probably increase our rates. And a lot of us are recognizing, the Association of American Indian Physicians just received a grant to do just that. As soon as we get done helping people, convince people about the importance of the COVID vaccine, we're also going to be working on the flu vaccine. So you bring up a really good point, but I think our community is ready for it. We just need to get the message to them.
Dr. Owen, I've been reading a lot about 1919 and how it changed things. And one of the extraordinary things about that era is that it spurred people to go into medicine. Do you think we'll see that again?
It's funny because we saw more, and I don't think it has to do with that COVID vaccine, but we saw more applicants this year than we have in a long time at our medical school. But I think that's more due to this on being able to interview online, and so not all that cost to travel, which we need to bring. A lot of these ideas that came because of necessity need to be brought into the future. Maybe we'll get more natives in medicine, and again, because of that caring for our community that we know exists amongst us. I'm hoping that that's the case because we certainly need it. In the Bemidji area where I work, there's a 46% vacancy rate for physicians. Additionally, nobody knows us like us. We have this shared history of genocide and trauma, and also more of us know about the social determinants that our communities are faced with, high rates of poverty and education issues from for many historical reasons.
Dr. Owen, you talk to physicians all the time. I'm curious how physicians see this as being something that's been changing for the way they do practice beyond just this particular pandemic.
Tell me what you mean by that.
The daily practice, how they go about their business, whether it be telemedicine or, so many appointments now are in front of a camera.
Yeah, it's actually interesting. The telemedicine piece has, the downside is that I don't have the same feel for how my patient is if they're really sick. I can usually ascertain that's easier if they're really sick, but if I don't have the same feel. It's not the same as seeing them, touching them. However, that said, we are seeing more people that we might not have seen before because they didn't want to come to the clinic for whatever reason, mistrust, couldn't get there because of transportation. We know that in Indian country, we still have the issue of broadband, so that will be a problem until we get that fixed. But I think that there are definitely some upsides so that we shouldn't lose this now that we've got it online. And, it's funny, we took how long wanting to get telemedicine and we couldn't. I was in Alaska trying to get it going. It was always awkward, but within the span of a month, it's working. And I don't think we should lose it. We have more access to people. Should we always use it? No, sometimes we need to see a patient, particularly when they're sick.
But it also can expand on just routine. Being a male, and I know how hard it is for males to go to a doctor, telemedicine can open up channels that we might not have thought before for even routine healthcare.
That's exactly right. Yep.
I'm curious, human beings being human beings, we're all wanting to get out and do things. And I know a lot of us think, well, we've got the vaccine, we should do whatever we want. And that's just not the case. Maybe, let me ask you about that.
Right. We're seeing right now actually raises again in infection rates. And that's because I think people are relaxing their guard and they are taking their masks off for less social distancing, and they're just going out more. But we have these variants that are roaming around the country, right? And they're loose and they are infecting people. What's interesting is I think I heard someone say this on your broadcast, but it's infecting more younger people, and younger people haven't all got the vaccine at the rates that the older folks have. So we have to be very careful. The CDC is warning about a national catastrophe again if we're not attentive to these. Wear the mask, wash your hands, social distancing. Absolutely. Thank you for repeating that. It's so important. And get that vaccine, whichever one's available.
And when you look at states and tribes have been at the front of saying, not only do these protocols matter, but we're sticking with them.
That's true. I think that we are leading the way. Some of our tribes have even said, no, you're not adhering to the CDC guidelines. You're not coming on our land. So I think this is a good good example of how sovereignty can save us, literally.
Now, I want to ask with these protocols, and I mean, how do you deal with basically people just feeling I can't take another day? How do you motivate them to say, just ride this out for X number of days to go or months to go?
We do whatever will work for that particular patient. So if I know that they are going to be pulled to want to save their community or help us care for the community, then I use that. If they are caring about, if I know that they're caring for their kids and they're really concerned about their kids, then I'll use that. I'll do whatever it takes to convince them, because it is really about the entire community. The more people who are not vaccinated, who are not adhering to this, the more the virus flies free and can infect people that we care about.
This may be a dark question to ask, but given what we've learned in the last year plus, we know there are other pandemics out there. And has this been a foundational study in terms of how we're going to do it next time?
I think this was so clear about the this made so clear the necessity for having a strong public health system. Even we have the structure within Indian Health Service, but we all know that we are severely underfunded. So we haven't been able to give it as much as we could. But the US public health structure has been in shambles, and it's shown, so absolutely, it's made us ready. So I think more funding, the Biden administration certainly seems to be wanting to put more funding into those baseline care to help protect us. And you're right, I think we're going to see more pandemics along the way. We haven't even seen the end of COVID, and look at the toll it's already taken on our community. As Native people, we are dying at far higher rates than any other population. We can't afford to keep losing more. So.
This last question, Dr. Owen, but I know you just said that that the Indian health system has done really well and it's underfunded. Those are both givens, but yet there's this narrative of decline about Indian health. 60% of the system is tribal, and it's really showing its resiliency throughout all of this, I think.
Is that a question?
Sort of, yeah. What lessons can we learn from that, I guess, would be the question.
I think it goes back to that sovereignty. We know we had thousands of years of caring for ourselves and knowing how to do that, and had tribal ways. Those were disseminated. We just, since 1975, with the Indian Healthcare Improvement Act and 76, have been able to get our feet under us and start running our systems ourselves. That's only 50 years, right? About 50 years. So give us a little bit of time to rebuild the way that we know it needs to be done, which is strongly a public health and community-based model, and where we each reach out and help care for one another.
Dr. Mary Owen, thank you so much for joining us today.
Miigwech, Gunischish. Take care.
And we'll be right back, and we'll look at a tribe that's brewing beer. Tribes are getting into a variety of enterprises, and in Southern California, that means you can now get craft brew with a side of culture. That's the headline of a story Natasha Brenna wrote for us recently. She joins us today to give us more insight into this business. Welcome, Natasha.
Good morning.
Well, give us the story. What's going on here?
Well, the Rincon Reservation Road Brewery, which is located in San Diego in Southern California, they're brewing their own beer. It's grown, the hops are grown on their own land with their own aquifers, by their own farmers. They bring in all sorts of flavors, and they all have different names based off of their own tribe's history, like the Tupash Ale, which is the Luiseno word for sky. They have Res Dog, all sorts of interesting names that mean so much to the tribe. Their brew is all done by the tribe. They have they brought in a head brewmaster who takes care of that. But the Redco, which is the Rincon tribe's economic development company, they've created the brewery. They've rebranded. They originally started as SR76 a couple years ago, but last year in January they relaunched as 3R Brewery, and then the pandemic hit, and so then they had to close. But this past fall they came back with a vengeance, and they're starting to have really great sales. They opened a tasting room. They're going to reopen a new tasting room later this summer, have deals with Costco, local casinos, and are bringing their culture to the San Diego area with brew. And as many know, the San Diego area is one of the capitals for craft brewery in the world. So they're really out there competing and doing great.
So they're competing in an environment that's already competitive. That's interesting.
Yes, definitely. That there's a lot of oversaturation in the market, but they're really making a name for themselves and a name for Native people in the space. There aren't very many Native breweries at all. This is the first tribal-owned brewery in Southern California. There is a tribal-owned brewery up north, and there's a couple in Washington. But other than that, we really don't have many tribal-owned breweries at all.
There is, of course, a narrative about Native Americans and alcohol. Does the tribe in the enterprise deal with that and have any kind of way of addressing that as part of the business?
Yes, definitely. I spoke to Ruth Ann Thorne, who's the Redco president or chairperson, and to Bo Mazzetti, who's the chairperson of the tribe. And they both agreed that this is a great way for Native people to take back that stereotype and demystify it and help their tribal people be proud of something that they're putting together and be proud of something that their tribe is doing and inspire them to not only create their own brewery or get involved, but be excited about other enterprises that they have the opportunity to do. And like Ruth Ann Thorne said, any group can have an issue with alcohol. It's not just Native people. So this is a great way to take back that stereotype and really challenge it and let people know that truly this is something that is an art form, and is not necessarily the detriment to their tribe. They're really excited to get to know this company, get to know their audience. And then in the future, they're excited to launch a apprenticeship program to help their tribal youth learn about the art form and the science behind brewing. And so they're really hoping to take back the stereotype with education, educating people about their tribe and the art and science of brewing.
It's also, and as a metaphor almost, because it's craft and craft is something you want to enjoy, that you're teaching moderation as part of even the marketing.
Yes, definitely. Yeah, their brewery and their tasting room is very decadent and beautiful. I think it really does speak to moderation and enjoyment.
I'm interested in the opportunities for young people. It's not something you think of right away, but whether it be food or other entertainment, there's a lot of opportunity for people in this industry.
Yes, definitely. Like I said, it's a saturated market, but I think young people, especially young men, are really excited to get into brewing. And I think that this apprenticeship program would be really great for their tribal people, their young tribal men and women who are excited to learn a little bit more.
Natasha, you mentioned Costco. Is it only sold locally or is there a national distribution for this?
Right now, I believe that they're only in 5 Southern California Costco's. So during Christmas time, they launched a holiday pack, and Ruth Ann told me that now they've re-signed with Costco, but before they had a sampler pack for Christmas, and they're going to sell with the separate flavors so they can learn what people like the most, and then maybe that there's future opportunities to grow there. They're also sold in the local convenience stores and in the casinos. So I think they're looking forward to finding out what people enjoy and maybe launching a lot more um, deals and future distributions all over.
And you can really see the opportunity for that because wine clubs, certainly in Southern California, sell nationally and have audiences all over the country.
Yes, definitely. Southern California is, we have San Diego's brewing, we have the wine country, we have Temecula where there's a lot of wine country. So it's a very saturated place for brewing, distilleries, wineries, but there's definitely room for them. They're making a name on it.
We have less than a minute. What are you working on now?
Well, right now I'm working on a story about how the pandemic has affected powwows. And, it's powwow season. And a couple of, including the biggest powwow in the world, is going virtual for a second year. So I'm working on a story about how the pandemic has affected them and what they're going to do this year.
Thank you, Natasha.
Thank you.
And you can find her work on IndianCountryToday.com. And that's a slice of our Indigenous world. We'll be back with another edition tomorrow. I'm Mark Trahant.
Sometimes you got to take a stand just because you know you can. Oh, you got to run, you got to run.
Indian Country Today is produced at the Walter Cronkite School of Journalism and Mass Communications at Arizona State University.
This is Indian Country Today.